good, thorough medical history is vital in helping to make a correct diagnosis for the treatment of sick children. History comes from the Greek word historias, which means to find out and document the past. Herodotus is a Greek historian who is called the father of history because he investigated and wrote down the history of the Greek-Persian Wars, which was called the Histories. And this is the first example of this kind of history-taking. Hippocrates was a Greek physician who is called the father of medicine because he started a lot of medical traditions, one of which was to document a patient history before making a diagnosis. There are guidelines on documentation of a medical history, which are used to quantify the level of the history in a standard way, and the level of the history is then used by insurance companies to decide on the appropriate payment for that visit. These guidelines were first formulated by the Centers for Medicare and Medicaid Services in 1995, and then a new set of guidelines was introduced in 1997, which are still in use now. The level of an office visit is decided by three parts: the amount of history, the extent of the physical exam, and the level of medical decision-making of that visit. A history has four main components: the chief complaint, the history of present illness, the review of symptoms, the past family and social history. The chief complaint must be documented at each encounter. It is the reason for the visit and may be in the patient's words. The HPI, history of present illness, is a description of the illness in chronological order, so from the beginning of the illness or the last visit until the present time. It has 8 elements. Duration, when did it start? Location, where is it? Severity, how bad is it? Quality, how is it? Sharp, crushing? Timing, is it constant or intermittent? Context, in what setting does it happen? Modifying factors, what makes it better or worse? Associated signs and symptoms, like other related symptoms. It has 2 levels. Brief has 1 to 3 elements, extended has 4 or more elements. The review of systems is questions about the various body areas to document relevant signs and symptoms that may help to make the diagnosis. There are 14 body systems recognized: constitutional symptoms like weight and temperature, eyes, ears, nose, mouth, throat, cardiovascular, respiratory, gastrointestinal, genitourinary, musculoskeletal, skin, neurological, psychiatric, endocrine, hematologic, lymphatic, and allergic immunologic. The past family social history has 3 areas: the past medical history, which is present medications, immunization status, allergies, previous illnesses and surgery, developmental history; the family history, which includes illnesses in the patient's family, causes of death, hereditary conditions. The last area, social history, has living arrangements, use of tobacco and alcohol. There are 4 levels of history for established patient visit. 99212 is a problem-focused history which includes the chief complaint, a brief HPI with 1 to 3 elements. 99213 is an expanded problem-focused history, and this includes the chief complaint, the brief HPI with 1 to 3 elements, and review of one system. A 99214 visit is a detailed history which includes a chief complaint, extended history with 4 or more HPI elements, review of 2 to 9 systems, and also a past family social history, 1 element. And 99215 is a comprehensive history, which includes a chief complaint, extended HPI, 4 elements from the HPI, review of systems, review of 10 or more systems, past family social history, 2 areas. There are 4 levels of history for a new patient visit. 99202 has the same history level as a 99213, which is expanded problem focused. And 99203 has the same history level as a 99214, a detailed history. And the 99204 has the same history level like a 99215 with a comprehensive history.